It is Heart Awareness Month, and one topic we want to discuss today is congenital heart disease. Joining us on the morning show to talk about the complications is Dr. Naser Ammash from Mayo Clinic. He's a cardiologist there. And then we also have a congenital heart defect survivor, Joe Meyer. Thanks so much, both of you, for coming on. First, we're going to start with you, doctor. Explain to people what is congenital heart disease who maybe have never heard of it or just don't quite understand.
Well, heart defects occur in 1 out of 1,000 babies when they're born. And it could be a hole in the heart, could be a missed valve, or some form of abnormality in the structure of the heart. Until the past 20, 30 years, only 15–20% would survive into adulthood because of the advancement in technology and how we take care of these patients, 95% of these babies now survive to become adults, which is a huge advancement nowadays.
And so, Joe, you said you weren't born with it, but you developed it. When did you find out, and what happened to you to get to where you are today?
I found out when I was 14 years old. I had a sports physical, and they heard a heart murmur. So then we just continued to get it checked out at the cardiologist. I was diagnosed with hypertrophic cardiomyopathy. So essentially the walls of my heart, the muscle was thick. And then just kind of it progressed to the point where when I was 17, I had a septal myectomy, which was just a surgery where they went in and removed the part of the heart that was obstructing blood flow. And now I'm a patient over at Mayo Clinic, so.
Wow. If he had never gone to the doctor to get that physical, I mean, and I hate to think the worst, but what happens when you don't go get your heart checked?
So if somebody has hypertrophic obstructive cardiomyopathy, like what he had, and he didn't have it checked, he could have had a high risk of sudden cardiac death, heart failure, irregular heartbeat, and stroke. But sudden death is the most important risk.
We see it, it's not common, but we see where teens just drop dead.
Yes.
And it's a lot of times they had no idea they had a heart problem. So now that you are where you are today, what are you able to do? Sports, normal things, now that you kind of are aware of your heart situation?
I was pretty restricted before, but once I had the surgery and now that I'm over at Mayo Clinic, I'm able to do some light exercise. I'm closely monitoring it. No competitive sports or anything like that, but definitely more than I was able to do before I had the surgery.
That's good.
And that's an important point to make, is that many children born with heart problems that become adult, they sometimes were told you cannot fly, you cannot do exercise, you cannot get pregnant in young women, which is not true in the vast majority of these cases. So the awareness about the possibilities of leading a normal life, being monitored by a trained physician is very important.
And so what if somebody does come to the doctor, they find out, because we were talking about this beforehand, people don't like to go to the doctor sometimes, no offense. What if they find out they do have a heart problem, but they're afraid to go through the surgery? Because a lot of people fear surgery. What could be the lead there if people don't go through with it?
So there are multiple available options other than surgery nowadays with catheter techniques, so we can do things that we could never dream about few years ago. So it is an option, but sometimes surgery is the best option. And it's a dialogue that we have with patients. We say, well, this is what we know, this is what we can deliver with surgery, this is what we can deliver with a catheter intervention, and it's a shared decision-making that we do with the patient.
And you'll be discussing that today. There's a congenital heart symposium at the Mayo Clinic, and it is on the 7th floor of the Davis building. It's from 1 p.m. to 3 p.m. And I know there's going to be some child-friendly events, so if you have to bring your child, you're good. But if you have any questions, the doctor will be there for you. Thanks so much for coming on.
Thank you.